first thing is concerns related to aging. There are three main areas that really sort of come across when I see patients in my clinic: memory loss and cognitive changes. The second is decreased independence, and the third is an overall loss of dignity. Why I want to talk about this is because these aren't really things that y'all are going to be, um, you know, really sort of aware of. It helps to build empathy and compassion, and that itself is going to be a huge support and one of the best ways in which you can actually care for people who might have dementia or some other aging related concerns. Um, I'm going to begin by defining what dementia is. Dementia is a constellation of symptoms. It isn't an illness in itself, but it's the result of different illnesses. So, the most common type of cause that you've heard of is Alzheimer's. Alzheimer's causes about 65% of the different dementias, and people who are suffering with dementia, 65% of them will have Alzheimer's. Then there are certain other causes like vascular dementia, which occurs because of repeated strokes. Strokes are basically there. There are two types of strokes. Just very quickly, I'll explain to you. When blood doesn't reach the appropriate part of the brain because of either breakage in the blood vessels or because of a block in the blood vessels, that's going to lead to a stroke. It can be a minor stroke or it can be multiple sort of smaller strokes. So that's vascular dementia. And then the third type that I want you all to know about, there are many others, I'm not going to get into those, but the third type is frontotemporal dementia. Now, frontotemporal dementia is basically where the frontal part of the brain, the part right behind your forehead, and the part behind your ears, the temporal lobes, those are the ones that are primarily involved. There are multiple types within this. Why is this important to know? Is because this presents very differently from Alzheimer's. In Alzheimer's, you know that the hallmark feature is memory concerns, right? Memory loss. Of course, I will be defining this a little bit more in detail, but frontotemporal dementia can present as a very significant personality shift in the late 50s. So, what happens is, let's say that you start noticing someone around you becoming very irritable, becoming very rude, becoming socially inappropriate. You're not really going to think of this as a medical illness that requires a neuropsychological or a neurological consult. However, it is. And very often, unfortunately, people reach a doctor only after very extreme things have taken place. So that's one type of frontotemporal dementia. Another presents with language disabilities. So there might be an interchange of words that happens. So calling a fan an AC or pointing towards the door and meaning the window. So that kind of thing can happen. Also very significant word finding difficulties. So it can be that thing that is blue, when you use it to cut something, that kind of a word finding difficulty is also a concern. Now, getting into overall what are the kinds of things that you might see. Cognition as an umbrella term, as a sort of function of the brain, basically means all of the thinking, scholastic skills that you use. So that's paying attention for long periods of time, not getting distracted, being able to learn new information, being able to remember appointments, being able to plan your day, being able to manage business decisions at work, being able to weigh out pros and cons, really sort of apply your mind and maybe discuss the news. These are the different ways in which you would see cognition playing out in everyday life. So it's simple to say that cognition is something that you need throughout to really function at your best possible capacity. Cognitive changes and mood related shifts are the ones that I'm now going to get into. These are the very early signs of cognitive changes. Okay, so subtle memory lapses are going to present as just occasional forgetfulness, momentarily forgetting someone's name or forgetting an appointment, or a repetition of questions, a repetition of conversations. Let's say you spoke to a grandparent yesterday and they told you something, and then 2 days later they bring it up as if they've not spoken to you about it at all. Or if they forget details of a vacation that they took. There are, of course, starker things like forgetting if a family member got married a few months ago, or somebody is no more, in the sense that if somebody has passed away and they don't remember that that person has passed away. These are more starker things. Mild confusion can also happen. So, getting confused about the time, the place, especially in unfamiliar situations, can be an early sign. Very often, I'll get patients in my clinic, who'll tell me that instead of 28th September 2023, they'll tell me it's the 20th of September 2023. That's a minor issue. Instead of Thursday, they might tell me that it's Saturday because it felt like a holiday today. That's another mild issue. But bigger things like getting confused about September versus November, or of course in the later stages you might also see them being disoriented to the year. That also happens. Instead of 2023, they might tell me it's 1978. So what I'm talking about are going to be the early signs, so that you can actually help your family members do what is required if you see a whole bunch of these symptoms present themselves. Word finding difficulties, as I explained, in conversation, you might find that it's becoming a little apparent that very often they're not able to get the right word. Then there's some amount of disorganization in their daily routine, or just difficulties in planning everyday events, or let's say a vacation. Social withdrawal, very big one. Okay, social withdrawal and reduced interest in hobbies. That, let's say that somebody has for years done crochet and knitting, and now they're starting to come up with little excuses. I'm finding it difficult to see, or it's just not interesting anymore. I've been doing it for so many years, why do I need to do it? Very often women will come in who've been housewives, and the family members will tell me there isn't anything much, but they've stopped trying out new recipes. Again, not being able to really sort of be creative is an early sign. Um, Apart from this, mood swings, fluctuations in mood, like increased, irritability, sometimes sadness, sometimes you'll see them get anxious, which might come across as, constantly calling you. Where are you? Where are you? When are you coming home? That kind of thing also. I know that I'm sure it happens with all of you. Doesn't have to mean dementia, but yes, it is, if it's happening beyond a certain degree. And the main thing is, please note that a change in someone's personality and behaviors is what is important. If somebody has almost always been like that, then it's a lesser concern. Changes in sleep patterns, so disrupted sleep, or sleeping too much, or waking up multiple times, or waking up in the middle of the night, and you might see them being confused, that is it daytime. So they might wake up at 3 in the morning and go into the kitchen to maybe make some tea. This does happen, and it is sleep induced sort of disorientation. All of these are early signs. Now, very, very important and a huge disclaimer, all of these can be caused by various reasons, and the only person who can actually identify whether this is dementia related. So, is it clinical or is it something that is caused by other reversible causes? It's going to be a professional who can do this. So, now which professional should you go to? A neuropsychologist is going to conduct an evaluation with your parent, grandparent, family member. Um, yes, Anuj, I will just actually ask you your question. Just a minute. Um, so, as I was saying, a neuropsychologist is going to conduct an evaluation of all of the different cognitive skills and all of their psychological emotional functions. A neurologist is also going to do a little bit of that, but briefly. They're not really going to do the detailed evaluation. They're going to ask you a few questions, and then they're hopefully going to be able to guide you further with some sort of medical investigations that need to be conducted to rule out the reversible causes. All of these cognitive changes and mood related shifts can occur because of reversible causes as well. So, sleep related disabilities. So, there are certain disorders of sleep which can cause this. There are certain metabolic deficiencies that can cause this. There are certain medication side effects that can cause this. All of this will be ruled out when you go to a professional. But your job is to recognize that, okay, there are these things happening. There's a change in my family members' um, behavior. So let me go to a professional. Okay. All right. Can I please have